I still believe in heart rate, but not for the reasons a lot of other people, they say, well, you know, you don't use wattage, you don't use speed. I said, no, those are measures of output. They're not a measure of your physiology.
Yeah.
And just trying to get them to calm the hell down. Yes, we will look at wattage as an output related to, you know, to what the work that you're doing. You know, a lot of people just look at VO2 max, but they don't look at their ability to do work there.
Mm-hmm.
And guess what? Somebody who has a lower VO2 max than you that can do more work is still going to kick your ass on race day.
Yeah, absolutely. We see that all the time.
So exactly. So what we've got to do is we got to get back to what it represents truly, and then be able to explain that to people in a very simple way. So in my case, you know, zone 1 indicates the intensity at which that you're stimulating O2 delivery beyond its requirement at the cell. So you're hyperoxygenating the area itself. So we go, okay, well, how are we going to identify that? Well, why is that important in the first place? Is because the fact you want to get rid of CO2 and you want to bring in O2 to the cell to help it recover. So, okay, well, we're going to name that zone 1. And it's going to be mainly, we know it's mainly fat oxidation, and it will represent recovery. So that's all of zone 1 kind of fits those things. How we can tell, obviously the only way you can tell, and this is, I need to make it clear, is only with O2 and CO2. That's the only way to identify fat and carbohydrate utilization. There's a lot of devices out right now that are only O2. You cannot tell substrate utilization with it. And therefore you can't really identify zone 1 and zone 2 because really those zones are identified by their fat and carbohydrate contribution.